Hi, everyone. This is José Stuchi, CEO of Phelcom Technologies. I'm very happy to be here at CCOI, showing how we are helping to democratize eye examinations in Latin America. I also want to thank you, Dr. Daniela Ferrara, for the invitation. It's really cool to be here and show you more details about what you're doing. Well, Phelcom is a Brazilian startup. You're located in São Paulo, and I'm a computer engineer, actually. I'm not a doctor. So, being a computer engineer in eye care is challenging, but on the other side is nice because I'm working with computer vision since 2006. So, we are mixing computers that I love with vision that I also love to create now medical devices. Talking about Brazil, Brazil is a huge country, speaking Portuguese, a little bit isolated, and we have about 200 million population and only 20,000 doctors for all this population. And the doctors, they are not well distributed in the country. They are more in the south and southeast regions of the country and working more in the state capitals. So in this scenario, 70% of the cities, they don't have ophthalmologists, and this number is almost 4,000 cities in the country. And they are more small towns, periphery, and remote regions, but the patients are there and they need care. Also about Brazil, we have now a big population of old people, 30 million elderly population, 40 million obese, and about 16 million of diabetics. So we have about 10% of our population with diabetes, and of course, they need screening for blood tests, eye screening, and others exams. And this is the main challenge that we have in the country. How can we provide a good care for all these patients? Because they are spread, the per capita, GDP per capita in Brazil, it's about $10,000. So it's 7 times less than United States. So it's a big challenge for us. And in this scenario, Phelcom started the development of a system to help for these examinations, combining mobile health, cloud computing, and artificial intelligence to allow a good examination in different areas where a doctor can access the exams using the cloud and the artificial intelligence helping the screening. So we founded the company in 2016. We have others partners. Diego, that's a physicist, Flavio, electronic engineer in the company, and Phelcom stands for the areas of these three founders, physics, electronics, and computing together. The company is located in the state of São Paulo, as I said, in the city of São Carlos, in the middle of state. The city is nice because it's considered the Brazilian technology capital, and we have a lot of PhDs in the city, a lot of universities and research centers. So it's a good place for hardware development, software development, and we have good suppliers as well in this region. Actually, we started the company with this inspiration. Diego's brother was born with a problem in the retina. Here we can see Welber with Diego and his retina over here. So these pictures were capturing with our first prototype in 2017, and we understood why Welb had this problem and cannot see well because it has this abnormality here in the retina. And using this inspiration, Diego started development of an optical system for a small fundus camera. These are pictures from the development. In Brazil, the development is not easy because it's different, the access to the capitals. In 2015, when we started, the war was still harder, but now things are getting better. But we started development with our own resources, and after we went to Anvisa, that's our FDA for approval. So here are some pictures during the implementation, working during the night, because at this time we were working for other companies, research centers, Samsung Electronics and University of São Paulo. But it was a really good phase where we brought this prototype and we put here in a nerve machine to take pictures of the retina. Well, and this was the first pictures that we captured using this device. This is my eye, Flavio's eyes, and Diego's eyes. So we are very excited with the results, and we submit for a grant in a research agency in the state of São Paulo called FAPESP, and we got the grant and we founded the company in 2016. This picture is when we put the logo in the company's wall. And after that, we continued the development of the prototype. Now we created this MVP, very ugly MVP, but with good pictures of the retina. And we hired this guy, Peter, a Swedish designer that helped us to transform this ugly MVP in a beautiful product that's Ayer. So the name of the products also changed from Smart Retinal Camera, SRC, to Ayer. So it's a big advantage to bring someone with experience in design because it makes all the difference for the product. And we launched the product in 2019 in Brazil. Doctors accepted very well. Here are some pictures using in the class, the medical school classes with babies for ROP and inside clinics and screening projects. And we had now the challenge for the production. So we created our own factory. We have all the approvals from Visa, Inmetro, FDA, and Japan, and many others. So many challenges for the development of this in Brazil. We launched the product in 2022 in the United States. So the product was well accepted in the market as well. And now recently we launched Ayer 2 that allows to capture good pictures of the retina, 55 degrees of the retina, and also the anterior sag with white, infrared, and blue light. Well, talking a little bit about the technology is easy because it's a product, it's a material product, but we have a big problem in Brazil with the implementation of this because we have this big population of 200 million people, but only 2,000 doctors that are retina specialists. Only 10% of our doctors, eye care doctors, are retina specialists. So in this scenario, AI can be used to help in the optimization, screening, and easy patient referral. So we started the development of Ayer maps in 2017. And basically, the system creates a heat map showing where the abnormality is in the image, and the technician, the doctor can decide if that patient will be referred or not. The good thing, doctors can review this using Ayer Cloud, so it's not necessary to be in the place with the patient. It can be done remotely, so it's all integrated. The system was used for more than 100 social projects in Brazil. This is one social project in Itabuna. So more than 1,600 patients were examined here in a school, and the results were incredible because we can detect diseases, refer the patients, and doctors can review using the Ayer Cloud and have a lot of patients to go for the treatment. The device was also being used in remote regions, indigenous communities, inside boats, in Brazil, in the Amazon region, in Africa, Northeast Brazil. So we are helping to bring the exams close to the patients and help a lot of people. And our purpose is make the visual health more accessible. And we are happy that we are continuously growing and help patients. We have research as well with many universities in Brazil for the validation of the camera, the AI, and all the technology. And we have good results with more than 90% for the detection of diabetic retinopathy in sensitivity and specificity. And this is a good result for me because our AI is a binary AI actually to detect abnormalities. Because in your scenario, the primary care units, the patients that are going to the primary care units, they need not only to know if they have diabetic retinopathy or AMD or glaucoma, but many other diseases like vasosterosity related to hypertension, toxoplasmosis, well, many other diseases, papilledema. So it's because of that that we create this binary AI to help to refer the patients for many different diseases. And here's a good validation for this. We also have this recent publication with a data set I believe that is the first mobile retinal data set available for research. So you guys can download this for research purposes and use, and you can also see the images captured using our camera. So it's cool because it's helping science as well. And here's some friends, doctors that are related to social projects in Brazil: Rafael Andrade, Malerbi, and Paulo Henrique Morales. These guys are incredible. They are doing an amazing job in Brazil, helping to democratize the exams and help patients. Here's some pictures in basic health units, public health in poor areas of Brazil, and also Dr. Paulo Shore, our great mentor in this company. And this year, we achieved this number that I'm very proud of: 4.2 million patients examined with IR, with 20 million images on IR Cloud. So we're very excited to help the patients with this dream, where you have the primary care with consistent automated eye screening, because the patients are there and the patients need the solutions to help to avoid diseases and improve their lives. Thank you very much.